Okay, so I wanted to give a brief summary of some of the key components to assessing a patient after a motor vehicle accident, particularly the history and physical exam components that are effective at guarding yourself from litigation and also improve your oral reports with your precepting physician. Earlier today, she states that the accident occurred on Highway 27. She was traveling approximately 30 miles an hour and was the driver of the vehicle. She notes that the injuries, the accident occurred in the left anterior quarter panel of the vehicle. The airbags did deploy. She was wearing her seatbelt and she was able to self-extricate the car with no assistance. Police and EMS were present on the scene and did do a quick evaluation of the patient. The patient declined transport to the hospital at this time. Additionally, the patient notes that she did not injure her head during the accident and did not have any loss of consciousness. The patient notes that she has a mild amount of pain in her jaw when she moves her jaw, but is able to do so and did eat before coming to the emergency department. She denies any headache right now, confusion, neck stiffness, back pain, abdominal pain, extremity pain, nausea, vomiting, or diarrhea. She also denies any fluid leaking from her ears or her nose. She denies any acute vision change, gait disturbance, difficulty swallowing, difficulty breathing, shortness of breath, cough, or hemoptysis. The patient does have multiple pictures of the accident, which I have reviewed. Something to that effect. So that's kind of what your verbal history would look like, or your written history. You want to screen out signs of skull fracture and intra-abdominal pathology. So here is a sample physical exam. It does kind of help to start from the top. That's how I do it. So we want to explain what they look like. You know, they're well developed, well nourished, they're resting comfortably, what their eyes look like, that the extraocular movements are intact and that they are pain-free. This is going to evaluate for any orbital fracture and kind of CYA for that. So we also want to talk about the ears. We should document the nose and that there are no secretions coming from the nose that are suggestive of skull fracture. Later in the head here we talk about there are no drainage from ears or nose, and there are no raccoon eyes noted. These are all signs of skull fracture. So that's just kind of an overview of the ENT portion as well as constitutional. Then we move on to the abdomen and heart as well as lungs. So we're going to obviously do a good cardiac exam, lung exam. We're going to palpate for crepitus in the neck area. So we want to make sure that they can move their neck well, that there's no nuchal rigidity. Added to this neck portion, we could say that there's no crepitus, which would be a sign of a pneumothorax or some air leaking into the mediastinum like a pneumomediastinum. Also, we need to comment on the abdomen that there are no signs of bruising, that they didn't damage their spleen or have some big liver laceration. So do a really good abdominal exam and a lower extremity exam. And then your neuro exam here is pretty much going to be fairly concise, but we want to make sure that they are able to make decisions so that if they decline any treatment, we can document this as well. Rectal tone, yeah, definitely in a major trauma, we want to check rectal tone to make sure that all their nerves are functioning appropriately and that there's no risk for cauda equina. In a low-grade trauma, the patient may defer this test, and that is completely meant that. And then the last components here, we need to do a good assessment of the entire spine, so cervical spine through middle back and lower back, and then the extremities you can add as needed. So if they have wrist pain, elbow pain, shoulder pain, something to that effect, then you need to go into an in-depth analysis.